Okay, in chapter 14, we're going to take a look at the various therapies that are available. So first of all, why do people seek therapy? And so there are a few different reasons that we'll talk about here. Number one, they may be experiencing what's known as a psychological disorder, which is basically troubling thoughts, feelings, behaviors that causes psychological discomfort, or they interfere with a person's ability to function. And second, that may be because of troubled relationships like parent-child conflicts or an unhappy marriage. And finally, there may be a person's experiencing life transitions. So take, for instance, death of a loved one, dissolving of a marriage, or adjustment to retirement. So those are many reasons one might seek psychotherapy or biomedical therapy. And we will definitely take a look at defining those a little more intensely as we go along in this presentation here. So first of all, the definition of psychotherapy. This is what's important to know right here. The definition of psychotherapy that uses psychological techniques to treat emotional, behavioral, and interpersonal problems. And psychologists, they are operating on the assumption that different factors, psychological factors, they play a significant role in those troubled feelings, behaviors, and relationships. And the different types of psychologists who will definitely address those issues can be anyone from a clinical psychologist to a counseling psychologist, psychiatrist, psychoanalyst, a licensed professional counselor, psychiatric social worker, or a psychiatric nurse. Okay, now also we mentioned the term biomedical therapy. So what the definition is of that is that's uses medication and other medical treatments to treat psychological disorders and their symptoms. And those are operating on the assumption that many psychological disorders actually involve biological factors. And so definitely licensed physicians and a very limited number of specially trained psychologists can actually use biomedical therapies. But more often than not, one has to have a medical degree to use these biomedical therapies. So first of all, the history of psychoanalytic theory began with Sigmund Freud, and we've discussed him before in previous classes. He used traditional psychoanalysis, and to uncover, he was mainly concerned with the unconscious conflicts that one might have. So he felt that a lot of psychological disorders and everything were the result of unconscious conflicts, things that were going on below the surface of our awareness and consciousness. And few of those techniques and analyses used to bring those repressed memories and things like that, the unconscious issues, were things like free association, dream interpretation, resistance, transference. And we'll take a look at those terms as we progress here. Okay, so just take, more often than not, when people think of psychoanalysis, or they think of Freud, they think of, the client or patient, if you will, actually lying down on a couch and actually discussing, as the analyst sits, with a chair and a notepad, and the client or patient, will be laying down on a couch and expressing their feelings and what they're experiencing. Now, that's not very common these days. It's not out of the question, but it's just not the most common way it occurs in a psychoanalyst's office. Okay, so right here, we have various definitions of the terms psychoanalysis, free association, dream interpretation, and transference in psychoanalysis. So please stop the video here and make sure you read these and gain insight and understand what they're referring to. There's a lot of information in this on these slides here for this chapter, and so I won't be able to stop and define each term. So please definitely be proactive. Stop the video when you need to and take notes and try to gain further insight into these. So short-term dynamic therapies, those are the types of psychotherapy. It's that are like psychoanalytic theory, but they differ in that they are typically time limited and have specific goals. So they're very focused on what they're trying to do. So another thing here is I'm coming down to the bottom where I added some notes right here. And so they say, the types of interpersonal therapy and identification of personal problems. So they said, they may deal with things like unresolved grief or role disputes, role transitions, interpersonal deficits. So I defined these. I put these in bold red for you to read. And these are the actual definitions of those terms. So please make sure you get those definitions down. Moving on. So another type of therapy is what's called humanistic. And humanistic therapy, that's concerned with human potential, self-awareness, and freedom of choice. And so that is operating on the assumption that basically a most important factor in your personality is the individual's conscious, subjective perception of themselves. So they're operating on the assumption that people are basically good and motivated by the need for psychological growth. And so more often than not, in humanistic type therapy, they'll apply what's called client-centered therapy. And the therapist Carl Rogers is actually known for developing that. So we're going to take a little bit of a more in-depth look into that here. And so client-centered therapy right here, that creates conditions that allow the client to direct the focus of the therapy. So the therapist isn't sitting there and actually directing or creating the direction of the session. They're actually letting the client actually direct where the session is going and how the therapy is going to happen, but while being definitely overseen by the therapist. Now, once again, right down here, is in red. I actually put some more definitions and some extra information you may be interested in knowing. So definitely feel free to take a look at those. Okay, so motivational interviewing, that is what is a type of therapy that a therapist would use to help clients commit to change. And so actually, helping them overcome their mixed feelings or reluctance about committing to change. So sometimes, an individual might, have things going on with, change, like say they're getting divorced or they're changing jobs or careers or going back to school or things like that. But they may be having or issues dealing with those dynamics, with those things, those scenarios that are occurring in their life. So motivational interviewing will definitely can more often than not help individuals like that. Okay, so behavior therapy, that focuses on changing what's known as maladaptive behavior patterns, and it uses basic learning principles and techniques, and this is also called behavior modification. So definitely, they're talking about they function on the assumption that maladaptive behavior, that's an interesting term, maladaptive behavior, they're learned. And so the basic strategy involves unlearning those behaviors and replacing those with learning more adaptive type behavior. So once again, please feel free to refer to what I added. These are notes that I added in red down here. here's some examples like nail biting and cigarette smoking are, like maladaptive behaviors that can be successfully treated with behavior therapy. And so that's just something to keep in mind there for this type of therapy. Okay, so techniques based on classical conditioning. So they developed by Mary Cover Jones. You do not have to memorize this person's name, but she developed what's called counter conditioning. And that's what, in red here, I define that for you. That's a behavior therapy technique. It's based on classical conditioning. It involves modifying one's behavior by conditioning a new response that is incompatible with a previously learned response. So it's actually replacing, by creating a new type of response, and it just doesn't, it's incompatible with the previously learned type of behavior. So it just replaces what the maladaptive behavior. Now, another thing to be aware of too, in regard to therapies, is therapists will actually use virtual reality to treat things like phobias and post-traumatic stress disorders. And so here's just an example of a therapist using, you can see that the client right here is using virtual types of intelligence and everything in order to kind of rewire what's going on in their brain. And so it's basically just rewiring based upon virtual type scenarios. And also in regard to therapies, it's called systematic desensitization and exposure therapies. And so the definition, is right here. Exposure therapy, that's usually used for anxiety, post-traumatic stress disorder, obsessive compulsive disorder. And so they'd use a systematic, I'm working my way back down to the bottom here, but you'll see the types. It's systematic desensitization involving progressive relaxation, anxiety, hierarchy construction, and desensitizing process through exposure. So what that means is more exposure to something that someone is dealing with gradually and incrementally will desensitize the client to that thing that's causing them discomfort, disorder. Okay, so I'm moving on here. So aversive conditioning, that's something that's pretty is what's known as it's pretty ineffective these days. And that was is kind of an older type conditioning and therapy treatment when basically clients would come in and they would say, hey, I'm afraid of spiders or something like that. And so the therapist would actually start actually having them look at real spiders, and eventually, maybe even having them hold spiders and things, and, all with the basically thinking that, hey, by relatively increasing their exposure to these, it's going to actually condition them to have less of a reaction to it. But please know, though, that actually this has been kind of claimed. It's known now in therapy that that's pretty ineffective, and it might not be the healthiest thing. Okay, and so we're looking at what's called operant conditioning, and that's basically operant conditioning just means behavior, learning behavior by getting based upon the effects of the behavior. And so take, for instance, like rewards. So one says, hey, I want to get this reward, so I'm going to behave in a way that will get me that reward. Well, that right there is an example of what's called token economy. And basically, I will let you read this here on your own so we don't run out of time, but way down at the bottom here in red, I said, basically in a token economy, here's an example, like maybe tokens or points are awarded as positive reinforcers for desirable behavior, and they're taken away or withheld when the client exhibits undesirable behavior. So they can be exchanged also for other reinforcers. So that's token economy. That's operant conditioning. So I'm just going to remind you again what they mean by operant conditioning. That means learning behavior that is desirable in order to achieve a certain effect or a reward or something of that to that effect. Now, contingency management, that's just basically it's kind of like a token economy, same thing, but it's really focused on one small set of behaviors at a time. And it's usually really effective in dealing with people who are dealing with drug dependency. Okay, cognitive therapy. So cognitive therapies, that's psychotherapies that focus on cognitive aspect of behavior. So remember, whenever I use the term cognitive, I'm referring to mental processes, cognition. Okay, so keep that in mind. And they just, talk about the various, what that is assuming and then the types of therapy. So things like cognitive therapy, cognitive behavioral therapy, which is very popular these days, and mindfulness-based therapies. So we're going to take a look at some of these a little more in detail here. And so so rational-emotive behavior therapy, the key premises of that is people's difficulties. They are caused by their faulty expectations in irrational beliefs. So an irrational belief, they actually can lead to self-defeating behavior, anxiety disorders, depressive disorders, and other disorders. So coming up here, when we talk about irrational beliefs here, they mention here, and I actually answered the question and asked the question down here, can you identify any irrational beliefs? And what I did is I put a lot of them here in red, a lot of examples of irrational beliefs. So please stop the video here and look at each one of those. And I think you'll find them very interesting. And you'll see how those can actually be to where they do not help the person that is experiencing these types of irrational beliefs. It can actually cause lots of problems in their lives. Now, cognitive therapy, is used for things like major depressive disorder, what we usually just call depression, but actually psychologists, we call that major depressive disorder. And those are usually caused by distorted thinking and unrealistic beliefs. And down here, what I did is I actually put some things that you may be interested in reading down here in red again. So steps in cognitive therapy, feel free to stop the video and look at the various steps here, how that happens. And cognitive biases in depression. So most cognitive biases, when one is depressed, they've got some different terms for those: arbitrary inference, selective abstraction, overgeneralization, magnification and minimization, and personalization. So basically what that means is things that can cause depression in some individuals are things like arbitrary inference. That just means just without any evidence whatsoever, just blaming. It's like, oh, the reason why this happened is because so-and-so just happens to be this way, or did this to me or something, but that's actually arbitrary inference. And that might not actually be the cause of, not necessarily the cause of their depressive disorder, but the cause of what they're actually experiencing psycho-emotionally. And things like overgeneralization, I think you understand what that is. Magnification and minimization. So that's magnification refers to making a mountain out of a molehill. There's a term that we hear a lot. Like over magnifying what the issue might be. Or on the other hand, actually minimizing it, basically just being in denial and not giving it enough attention. So those are some examples of some cognitive biases that are can take part when in depression, major depression. Okay, I'm moving ahead on this one here. We've talked about these. So mindfulness-based therapy. So basically, down here at the bottom in red, and I put this in here. So mindfulness practices are based on Buddhist meditation techniques. And so clients are taught to observe and change their relationship to maladaptive thoughts and behaviors. So that is another form of therapy that is gaining ground these days. So a couple others, group therapy. So group therapy, that involves one or more therapists working simultaneously with a small group of clients. And some of the advantages they talk about down here, that it's cost effective, it's less costly for clients, and actual interactions with others, right here, actual interactions with others can be observed. So the therapist can actually watch and observe how one might be interacting with others and say, oh, well, that right there might be a maladaptive type behavior or something to that effect. Okay, so now how are we doing as far as meeting the needs for those needing mental health care, and especially here in the United States, where this is, say, well, in the U.S., more than 2/3 of people in the general population who have mental illness, they actually go untreated. And there's even higher rates for African Americans and Hispanic Americans. So you might want to take some time and think about that and think about why that might be the case. And so they talked about some technology-based help and solutions for those, e-health. So using computers or smartphones have been helpful to some people who cannot afford to go see a therapist on a regular basis. And other techniques, like meeting on Skype or via email or text, things like that. Those are actually common and helpful for people who cannot actually go visit a therapist in person. Okay, so this is just a little more self-help groups, and so feel free to stop the video and read this if you would like to gain more insight into this. Family therapy, so that's a form of psychotherapy that's based on the assumption that the family is a system and that treats the family as a unit. So since the family is a system, a unit, so that by treating that unit all together sometimes can actually help treat some of the maladaptive behaviors in the actual individuals within that unit. And so there's a lot of different approaches there. And couple therapy, so the goal is on that is to actually, and I'm going to hurry down to the bottom here. I'm just going to proceed down to the bottom. And in red here, I said, the goals of, couple therapy, generally speaking, are things like improving communication, reducing negative communication, or increasing intimacy, or sharing responsibility of the relationship challenges and with less blame. So not blaming one's mate or partner for what might be something completely different, like say, take for instance, financial problems or something like that. So that's where couples therapy can be really helpful. Now, just, overall, when one evaluates the effectiveness of psychotherapy, it's, it's definitely a basic strategy for investigating effectiveness, that they use. And so researchers, they use a lot of different, looking at all of the research that's been done and combining it all. That's called meta-analysis. And that's a large number of studies, and they're combining all of the data from each study and combining them all into what's called a meta-analysis. And so what's challenging about evaluating the effectiveness of psychotherapy is, number one, it says right here, most people, they don't seek professional help for their problems. And many people just seem to seek help from friends and family, just talking it out. And last but not least, some people eventually improve simply with the passage of time. And so that makes it a little tough to evaluate the effectiveness of psychotherapy in general. Okay, so feel free to pause and look at this if you like. And is one form of psychotherapy better than others? And generally, one is not more effective than others, but one type of therapy might be more effective for specific problems or issues than the others. And so here are the different types we've discussed here, right along here at the bottom. And so these talk about where they might be most effective and least effective. Please become familiar with these. And what factors contribute to effective psychotherapy. So definitely a good match between the client and the specific therapeutic technique that they're using. And depends on, what the personality and the characteristics of the specific client and how they relate to the actual therapist. And a couple of these others here that I'll let you look at on your own. And last but not least, we'll look into cultural values in psychotherapy. So how do different cultures view and value psychotherapy? Now, right here, in red, I put a lot of information for you to look at, all the different cultures and their attitudes and how they value psychotherapy. So please pause the video and look at each of these, become familiar with these. Now, we're going to look at biomedical therapy. And remember, those are medical treatments for psychological disorders, but they do it through physiological processes. And that usually includes medication and other types of therapy like electroconvulsive therapy. Now here's the pros and cons of different antipsychotic medications. And so this actually on the left-hand side, this talks about the different types of antipsychotic medications. And then on the right hand, right here, they talk about the drawbacks of those. So please become familiar with those. Here's just some typical atypical antipsychotic medications. We don't have to work on memorizing all these. Our goal is not to memorize the names of drugs in this presentation. We just want to be fairly aware of some various types. Okay, so this talks about anxiety type medications on this here. So lithium is used to treat bipolar disorder. And this started out, way back, over 100 years ago. And so the thing is one has to be careful with the dosage because too little, and then the bipolar symptoms, just come right back really quickly. But too much, and that can actually cause physical problems, with the client. And so they talk about those right here, low lithium level problems, too low, too high, and how the effect those have. And so if those on lithium, their blood level must be carefully monitored on a regular basis. And so how does that work? What is it actually doing? Well, that actually affects the levels of excitatory neurotransmitter that's known as glutamate. And so you do not have to memorize that. I just wanted you to know that actually affects levels of excitatory neurotransmission. So for antidepressant medications, we can, look at, basically the symptoms of major depressive disorder, things like a sense of hopelessness, guilt, dejection, suicidal thoughts, difficulty concentrating,